morning, everyone. I'm Karina Hill, and on behalf of the Florida Alcohol and Drug Abuse Association, we'd like to welcome you to today's webinar entitled Shelter from the Storm Inside, Supporting Recovery, Safety, and Well-Being During COVID-19 with Gabriela Zapata-Alma. This webinar is being made available through a collaboration of the Florida Department of Children and Families, Office of Substance Abuse and Mental Health, and the Florida Alcohol and Drug Abuse Association. Please note that as an attendee, you are in listen-only mode and will only be able to view your name. If you have questions, please send them to the presenter and me by using the Q&A panel. The button to open the panel is usually located on the upper right side of your monitor. Please use the Q&A panel to send any questions you may think of as you think of them. The presenter will address them as time permits. Our audio is broadcast through the internet to your computer. If you experience poor computer audio through your computer, try rejoining the webinar and call in using the I will call in option. You must be connected to the audio of this presentation and view it on the screen as well to receive a certificate of attendance. The recording of materials used in today's presentation will be available on the FADA website within 30 business days. One helpful hint is the archived video displays what looks like to be an error message, but it's only a delay buffer, so you can ignore it, hit play, and enjoy. To access the recording and PowerPoint, you will go to www.fada.org, our resource center, and our training library.
By what?
FADA produces many webinars and workshops through the support of the Florida Department of Children and Families. To help participants track credits earned through attendance, we host an online online community that provides a personalized digital journal where participants can maintain statements of credit for webinars and workshops taken through the Florida Alcohol and Drug Abuse Association. At the end of today's webinar, the web browser will direct everyone to an evaluation form on the FADA website. You will first need to register or sign in to your account to complete the evaluation. Information you provide FADA as part of registering remains confidential. Statements of credits will be posted within 5 business days after the evaluation closes in individual professional development journals for persons completing the evaluation and attending the full webinar. Completing the evaluation is necessary to receive CE credits or to access your statement of credit. Please note that the evaluation will close at midnight on Friday, April the 17th. 1 to 2 continuing education credits are available for participating in today's webinar. For persons licensed through the Board of Nursing, the Board of Clinical Social Work, Marriage and Family Therapy, and Mental Health Counseling, and for persons credentialed through the Florida Certification Board. If you are a licensed healthcare practitioner, be sure to include your Florida license number for reporting to CE Broker when you register with our site for the first time. If you are certified with the Florida Certification Board or licensed outside of the state of Florida, you don't need to provide your certification number when you register with our site. Note, please, that WebEx monitors arrival and departure of attendees and provides a report upon completion of the event. We are not permitted to provide contact hours or a certificate of attendance if you do not attend the entire webinar. We are not permitted to provide partial credit. And now I'd like to give you some information about our presenter. Gabriela Zapata-Alma is the Director of Policy and Practice for Domestic Violence and Substance Use at the National Center for Domestic Violence, Trauma, and Mental Health, as well as a faculty at the University of Chicago. Gabriela brings 15 years of experience working with people living with HIV/AIDS impacted by housing instability, substance use disorders, and mental health conditions, as well as survivors of domestic violence and other trauma. providing direct services, training, advocacy, and consultation, and leading programs using a trauma-informed approach, motivational interviewing, harm reduction, gender-responsive care, housing first, and third wave behavioral interventions. Gabriela has provided technical assistance through SAMHSA and other national leaders in the best practices. Gabriela has been recognized with numerous awards, including Health and Medicine Policy Research Group's 2018 Health Award and the Illinois Association of Addiction Professionals chapter of NADAAC's 2017 Rising Star Award. Gabriela has provided training and technical assistance related to serving marginalized communities impacted by trauma and other social determinants of health, local, nationally, and internationally. And now I'd like to welcome our presenter, Gabriela. I will turn the presentation over to you.
Thank you so much. Thank you for that lovely introduction. And thanks everyone for being here today, for tuning in. And so I hope that this webinar finds you safe and healthy, finds you and your family and loved ones safe and healthy in this global crisis. And so today we'll be talking about, so this is shelter from the storm inside. So what can we do to support recovery, safety, and well-being during the COVID-19 pandemic? And something I wanted to mention quickly is that, this will talk a lot about kind of the overall risks to our safety and well-being. And we will have another webinar on May 5th that is specific to relapse prevention and overdose prevention. So I'll only touch on those very, very briefly today because we are going to have a session where we take a real deep dive into that. So you already heard about me, and here's my email contact. Please feel free to reach out to me. And then a little bit about our center, the National Center on Domestic Violence, Trauma, and Mental Health. We're funded through the Administration for Children and Families, and we're the only special issue resource center dedicated to addressing the intersection of domestic violence, trauma, substance use, and mental health. And so we provide a comprehensive array of training and technical assistance, research and evaluation, policy development and analysis, as well as public awareness. There's a lot of different free resources on our website, so please feel free to visit us, and you'll find a lot there around trauma-informed care, as well as resources for substance use and mental health professionals in responding to the needs of survivors of domestic violence and sexual assault. And then, of course, my disclaimer, the things I say do not necessarily reflect the official positions or policies of the U.S. Department of Health and Human Services. And our core integrated framework, so everything we do is really informed by and rooted within this framework, so that we take survivor-defined approaches, which are really rooted in relationship and connection, nurturing hope and resilience, and that this is possible through supporting physical and emotional safety. And those core pieces, from there, then we're able to practice trauma-informed approaches, a human rights and social justice-based approach that has an attention and awareness of cultural, historical, and community context, and that this is all done from an empowerment framework that really comes from and is informed by domestic violence and sexual violence advocacy. And our learning objectives for today: to become familiar with how the current pandemic can increase risk factors, as well as decrease access to protective factors for people experiencing concerns related to substance use, mental health, as well as intimate partner violence and other family-based violence. To identify strategies for supporting clients, teammates, and ourselves, and to become familiar with local resources that can aid in responding to the current pandemic. So all the resources that I'll talk about today are accessible for folks based in Florida. If you are tuning in from a different location or you have questions about different communities, perhaps you have loved ones impacted in different communities, there are some of the resources that I'll highlight that are national, and also feel free to reach out to me, and I'm happy to do my best to connect you with any local resources. So our first piece, oh, and I'll say about midway through, so around the hour mark, we will be taking a 5-minute break. So the first piece, bracing for the storm. So this part is really about cultivating our awareness about the increasing risks and then reduced access to resources. And the 4 main areas that we'll be thinking about are substance use disorder, mental health symptoms and crises, intimate partner violence, and then child abuse and neglect. That doesn't mean that these are the only risks going on. These are just the main ones that we'll be focused on. But first, I want to hear from all of you. So if you can please enter in the chat. What are you seeing and what are you anticipating? So what kinds of risk factors are you seeing increase during the current pandemic? And I'll give you some time to go ahead and enter some of your thoughts in the chat box. So I'm seeing depression, isolation, stress and uncertainty, homelessness, especially in mental health, stress and unemployment, anxiety, lack of social connectedness, a reduction in access to care, suicide, lack of structure and routine, hoarding, lack of recovery meetings, mental health declining, anxiety and stress from not being able to see relatives, child abuse, relapse, more suicidal ideation, isolation without connection, guilt. Absolutely, guilt is coming up for a lot of people, almost something very similar to a survivor's guilt. Stuck at home with abusers, lack of routine. So here from Jennifer, my clients are teenage girls, lots of anxiety and fear over finances, parents not working, parentified children. So when children are put in a position to take on kind of adult responsibilities, and girls being in close proximity to their families who range from unsupportive to abusive, absolutely. Isolation of families to other family members, lacking of support with homeschooling in the home, blaming, lack of control, frustration with being stuck at home with kids. And this can be a real double-edged sword for folks. There can be a lot of guilt that comes up with that kind of stress. Like we look forward to time with our family, but then we're also very stressed by the current circumstance, and then we start kind of blaming and shaming ourselves because of feelings of stress of being home with our children. It's like very similar to a lot of the feelings that come up with postpartum depression of like, this is supposed to be a happy time in my life, and it's not, and I don't really have anyone to voice that with, and it feels wrong to even feel those feelings. Transgender people in non-supportive homes. Lack of supplies, because the school I work at often supplies food and other supplies to the family, and the lack of food. Absolutely. Substance use, unhealthy relationships with substances. The need for food breeds anxiety, domestic violence, financial stress, kids not getting enough food, fear. And this fear that is really a prolonged fear. We don't know how it's gonna move forward, when the next phase will be, what that will look like. And that really leads into, as Jared here has stated, increased anticipatory anxiety. Absolutely. Sleeplessness, a lot of trouble with sleeping, sense of overwhelm, increases in DUIs, lack of access to care, economic hardship, a lot of people relapsing, absolutely. hopelessness, depression and worries about the future, people being in survival mode. Absolutely, and how survival mode, on the one hand, can be a really protective thing as it helps us get through the immediate threats to our safety. But what does that mean when we're in a prolonged survival mode, a survival mode that is just ongoing? And what is the impact of that kind of being in kind of that chronic, almost fight or flight? And at what point does it start to become freeze because fight or flight aren't accessible to us anymore? Amber shares, I'm seeing an increase in anxiety and depression stemming from lack of employment to make sure the bills are paid, which some participants are turning to drugs to cope. And absolutely, that we know that people many times use drugs because drugs are very effective in the short term for changing how we feel, for numbing some of those really the hardships that we're going through. And yet we know that drug use can be an attempt at a solution, which then becomes a problem. Advocating long distance for loved ones in nursing facilities. Absolutely. And how helpless we can feel when we're trying to advocate for folks and we can't have immediate access to them. Disunity in 12-step fellowship. Yes, and as many people have also noted, the lack of access to technology, or what's known as the digital divide. And so where some folks may be trying to bridge some of that lack of access through digital resources, that's not something that is available to everyone or available in the same ways. And then Nicole shares, the people I serve don't feel like talking on the phone or through Zoom is effective or satisfying therapeutically, which they have confessed to me has them wondering what the point of therapy is during this time. So people really feeling that lack of connection, even when there is access to technology and digital resources, vicarious trauma, or also what's known as secondary trauma. So in experiencing what others are going through as our own, and that ourselves as, responders in this crisis, that we also have our own, we're going through our own stressors, right? Because we're all in this. None of us are completely untouched by this pandemic. And we're also in a role to be feeling that with our clients and feeling what they're going through as well. And that when we are truly present with people, that there are parts of their experience that through kind of walking alongside them and being truly present with them, that we are also impacted. And then Dr. Teresa Jefferson shares, my students have expressed sadness in not being able to see their friends and teacher. Absolutely. And that children are going to have, and adolescents and young folk and people who are in student environments are going to have different ways of expressing this. Some are going to be able to kind of name it, and others are going to be showing us with their actions. That's why it's called acting out, when we try to show the things that we cannot put words to yet. And then Jennifer shares, it's difficult for my clients to have a, quote, private space to talk to me, to have a doxy video chat because their parents and siblings are around. If they talk to me on the phone, they have to go outside or away from families, and it really makes it hard to get it deep into a session. Yeah, so as you may hear some background noise, as I can hear my son outside my office door, there is, and I am privileged to even have a door to put between myself and my family, a door that I can lock and can create some semblance of private space, and that for many people, that's not even necessarily a reality. Gabby shares, I have many parents who are afraid of going to doctors even if the kids have medical needs. Absolutely. the fear of exposing ourselves to what seems like any potential risk, and the constant balance that we're having to decide what has risen to the point where we absolutely need to take some risks in accessing some kind of care, and then what do we try to just deal with on our own because we're so afraid of the unknown risks at play. We keep hearing about the coronavirus being talked of as the novel coronavirus, right? So it's new to all of us. And that it's new in a whole lot of different ways. It's new in that none of us have immunity, but it's also new in that we have never passed through this kind of pandemic in modernity, in kind of modern times. And so really kind of we're paving the ground by walking it. And then Kimberly offers work-life balance. And I bet a lot of us are really feeling that crunch right now. And a lot of the folks that we endeavor to support are also feeling that crunch right now. So, you know, that when it's almost like time has become amorphous in a lot of ways. And so it's like the times that we're working and the times that we're trying to then have that more life balance are all blending into each other in different ways. And that it's almost like the day slips by in really odd ways, that our sense of time is completely thrown off. And that we know that that's also something that comes up whenever we're under heavy stress, that our sense of time gets really impacted. I'll share a humorous kind of aside from my personal life. My son, who I just mentioned, he is 5, and he has learned this new phrase, which is, "Has the dog eaten yet? Oh, that poor dog." And he just learned because he's heard us say it so many times. It's like, you know, all of a sudden it's afternoon and we're like, wait a second, did we give the dog breakfast? And just all of these ways that time gets completely thrown off and that our work-life balance is completely thrown off. And that the fear in this pandemic has a really big impact, particularly on people who are in recovery or in any kind of targeted or vulnerable position. And so I know that, and I know that y'all can't see each other's comments. That's why I'm trying to do my best in reflecting what people are sharing. And so I'm trying to read the comments out loud. And that said, there are a lot of comments flowing in. And so if I didn't catch your comment, I'm sorry. It's on my side, the comment box is just moving so quickly, and I'm trying to scroll back and, you know, catch ones that have scrolled by. But I'm very sorry if I didn't reflect yours. And as we go on, please feel free to enter your thoughts in the comment box, and I'll do my best to keep an eye on that and mention those as I see them come up. And one more theme that I've seen mentioned many times, balancing our actual nutrition and diet. So what kind of eating what maybe might feel good emotionally, but maybe not feel good physically. And I know that I can certainly relate to that. I spent a good week carb loading and then found that my body felt like a disaster, and have been gluten-free now for the past few days. And my body now is feeling much better. And so absolutely, you know, so these are things that all of us are going through in one way or another. And while we're all impacted, also being able to hold how the kind of commonalities of our experiences, but also how we all respond and have unique aspects of and experiences within this pandemic as well. Thanks, everyone, for your input and your comments. So now looking at some of the common risk factors coming up for folks. So one is the loss of income that many people are experiencing, increasing layoffs, furloughs, and an overall loss of income. And so here's some data specific to Florida. And so this is a chart of the initial unemployment claims that were entered by week. And here you see starting from January 4th and then ending the week of March 21st. And just that rapid increase just in that 1 week from March 14th to March 21st. And while the data wasn't immediately available from the Department of Labor for the weeks following the week closing March 21st, we do know that based on the advanced status claims submitted by employers, that this number has just continued to rise exponentially. And so we see that Florida had an increase of 67,850 applications for unemployment insurance the week ending of March 21st. And that the unemployment system, of course, is inundated. And so this graph reflects job loss as of 1 week prior because of the previous requirement to wait a week before people could submit an unemployment claim. Now, that said, that 1 week waiting period has now been lifted, but as of March 21st, it was still in effect. So that immediate rise, that huge rise, the week of March 21st actually reflected job losses the previous week. And at the same time, many will not qualify for unemployment benefits for many different reasons. Potentially because of underemployment, potentially because they're working in more of these kind of gig economy type jobs where unemployment benefits are not necessarily part of they don't qualify because of the way that it's set up. And this graph also doesn't reflect all the people who rely on employed family members for financial stability as well as health benefits. And so along with the loss of income, we also have to keep in mind that for many people, this also means a loss of health insurance coverage, and that while there may be different safety net programs that help folks access health benefits after kind of an event like this, that often takes time, and all of those systems are really inundated right now. And so some things to think about: financial stability and access to health insurance and medical care are protective factors for trauma, mental health, and physical health. And that lack of income resources not only increases stress, but the lack of routine and structure can also act as a risk factor for mental health and substance use conditions. Additionally, financial instability is also a barrier to safety for survivors of domestic violence. And this is a big reason why abusive partners often use financial tactics of abuse, and DV programs offer many services and resources to support survivors' financial stability. So really looking at how this one risk factor has all of these ripple effects across all these different issues and situations that really can threaten our basic well-being and recovery. And then looking at isolation, knowing that mental health conditions such as depression thrive in isolation, and that substance use can also be exacerbated by isolation in addition to feelings of loneliness. We also know that abuse thrives in isolation, as abusive people often seek to cut the people they abuse off from sources of safety and support. And that isolation can also represent a loss of social support, particularly for people who do not have stable phone and internet access to readily connect with social support. And so here, really thinking about how isolation is a risk factor for all these different concerns. And I was in a meeting with some substance use treatment providers yesterday, and one of them very, very wisely offered. She said, you know, it's like everything that we try to support as a part of someone's recovery is the opposite in trying to create safety in this pandemic. And meaning safety in terms of really trying to control the contagion and all the loss of life from this pandemic. So really keeping that in mind. And then the common risk factor of grief. So someone mentioned earlier in the comment, anticipatory anxiety. And so we're also understanding how anticipatory grief is coming up for people. So that sense of that we, for many of us, we're anticipating the loss of life that is happening and that is starting to touch all of our lives and has been happening globally. And the ambiguous loss, the loss of our daily realities and routines, the loss of a sense of normalcy, and that shaken sense of self. And Erica wrote in the comment box, the grief of not being able to attend funerals too. Absolutely. So our interrupted rituals and social connections that help cope with a loss. So that, you know, all of us, in one way or another, whether it's kind of explicit or implicit, whether it's something that we've like named for ourselves and in our families, or it's something that we just kind of assumed and was in the background, but that we all hope for what's often referred to as a good death. And what does that mean? That means for many of us to be able to be with our loved ones, to be able to be there in those precious moments as that transition, that kind of final life transition takes place. And then what is so supportive and restorative for so many are all of our cultural practices and social norms, and for many of us, religious rituals around what it means to mark someone's life. And that in this pandemic, even that is being interrupted. And then all of the social connectedness, how we rally around folks when they've experienced such a primary loss, and how that is also interrupted. And then looking at complex and chronic loss. That loss in a pandemic is complex, meaning that there are multiple sources of loss, and that it is chronic, meaning that it is ongoing. And then JD also posted the interrupted kind of life event of being present during a birth. Absolutely. And that's also a piece of that many people, it can come up for that grief of not being able to be present in that moment, and then what it means for people to be, giving life and giving birth without that, the sharing the moment with, or not moment, oh my goodness, moments, the never-ending labor. I'm reflecting on my own experience of birthing. But just what that looks like in a pandemic, and what that looks like when we're not able to have our social supports, and for many people who may use not only family members but also doula support, and what that looks like. And that we know that things like postpartum depression also thrive in isolation. And then looking at increased risk for complicated grief. And so when acute grief becomes chronic and debilitating and gets worse over time rather than better, then a lot of times this is what we know as complicated bereavement or complicated grief. And so some things that are risk factors here for complicated grief is pre-existing mental health conditions, multiple stressors, or substance use issues that can complicate the grieving process, and that all of these increase the likelihood of complicated bereavement disorder that may then necessitate professional treatment. And so all of us, given just the very nature of this pandemic, are at increased risk for complicated grief and the ripple effects that can have in our lives. And thinking about, for those of us that may have an empathic connection or may approach our relationship to kind of a sense of connection with our community, with even just humankind, and what it means to kind of feel on that kind of deep level the universal grief that our world is going through right now. So there you have it. You all know I'm an empath now. And then another common risk factor, juggling increasing responsibilities and needs. So many people I've spoken with in substance use treatment centers, mental health providers, students as I continue teaching now virtually, DV advocates and sexual assault advocates, my own coworkers, and then people in just my social networks. There is this sense of, I have never been this stressed and this busy at the same time, that as all of my needs are increasing, so are my responsibilities. And that everything that goes into even just making sure that there's enough food, that, the things are as clean as possible, that we're kind of reducing our risk. And all of the loss of kind of that work-life balance, of just life balance that gets stuck in the way there, gets kind of caught up in trying to juggle all of these different increasing responsibilities and needs. And for those who may also be juggling the needs of different family members, whether it's homeschooling and trying to work from home, or homeschooling and then trying to figure out how to, get some access to income again and meet our basic needs, or if it's, caring for elders, or trying to care for elders that we no longer have access to because we either literally can't visit them, or they may be in different kinds of extended care or nursing facilities, and trying to do our best to advocate for them when we don't have access to them, as well as attend to those relational needs and sense of connection in these times. And so it's like so many things that were just part of our routine, that was part of taking care of ourselves and just staying alive. And when I say basic, I mean basic, like showering, eating, doing the dishes, really, really basic, now take a whole lot of different kinds of attention and energy to do in the face of a pandemic. And so taking that in too, that, with stress, it's like a lot of times what our body is asking for is for us to slow down and try to restore ourselves. And instead, all of our needs and responsibilities are kind of pushing us into hyperspeed. And so this push and pull that we're dealing with. Talking with students in my courses, I'm very grateful that they feel safe enough to tell their kind of instructor, how difficult it is to push themselves to even do the readings for the course. But it's just like everything inside themselves is just asking them for space and time to slow down and tend to themselves, and that all of the expectations for them remain the same, except that it's even harder to meet those expectations because of everything that they're juggling. And folks are writing in the comment, yeah, difficulty getting medications for ourselves or anyone under our care. And that also shared, DeEtte also shared significant increase in required contacts with our girls we work with to ensure their safety and emotional well-being. Some who have little access to the needed technology, combined with monitoring requirements of my daughters to complete their online learning. I can sit all day and be in more pain than if I had done a workout. Oh my goodness, that is so true. So many people I've talked to, it's like and I can so relate to this as well, is feeling like at the end of the day, this physical exhaustion as if we've been running a marathon all day. And it's like I could have not moved from this single, seat or desk or couch, just trying to take care of all these different needs. And yet the exhaustion that is both mental and physical, and for those who connect with any kind of, spiritual life, can also a sense of even spiritual exhaustion potentially. And so all of these kind of juggling the increased responsibilities and needs, and how that changes in these unprecedented circumstances. And then also here came in the comment box, coming home from work to a family that has stayed home and out of the community, and what it takes to ensure that individuals who are staying home are safe and not being infected by those returning home. Absolutely. Thank you for sharing that, Natalie. And so for those who are essential workers and do need to leave the home to continue providing services, and that's many of us on this webinar, that is, many of us who are working in residential treatment settings, who are working in shelter settings and housing settings, who are working in healthcare settings, social workers, treatment providers, advocates, child welfare workers, absolutely. And I want to first express my gratitude for all of you that continue to respond and be out there and be present, because we know that, the needs don't stop in this pandemic. If anything, the need is greater. And then all of the kind of the increasing responsibility of what it means to then, for those who are coming home, for all of the kind of, sterilizing and all of the kind of risk reduction routines that we're putting in place in order to minimize the potential of bringing something home to our loved ones. Absolutely. Thank you so much for everyone and all of your continued input in the comments. And so because we just talked about a bunch of different risk factors, which we are not immune to, I want to just take a pause so that we can do a mind-body practice, a grounding exercise together, so that we can just kind of get back in our bodies and back in the present moment. So if we can, this is a very simple exercise known as the 5, 4, 3, 2, 1. So if you can take a moment and name internally to yourself 5 things you can see, 4 things you can feel, 3 things you can hear, 2 things you can smell, and 1 thing you can taste. This can also be simplified as just a 3, 2, 1. And this is something that can be freely used, can be freely shared, that we can do almost at any time. And in the, kind of overlapping stressors that we're all dealing with, it can be so easy to forget building in these moments. And so this is something that I invite everyone to get creative and how we can continue to build in these grounding moments in our day-to-day realities for ourselves, for our staff, and for our clients. So continuing to look at these common risk factors. All of what we're naming here in many ways comes down to stress. And so stress, anxiety, and fear are all common reactions to crisis, right? So these feelings don't mean that there's something wrong with us. And so having acceptance and self-compassion around what we're going through is real, and our responses to what we're going through is also real. At the same time, being able to look at and have an awareness of, when does this stress become traumatic? And so I'm going to quote, or before I give the quote actually, I'll say this. Fear and stress aren't bad necessarily. They're actually quite necessary for our survival. So at what point does it become counterproductive for us and potentially start to have adverse health effects? So in short, when our stress overwhelms our available coping resources. And so coping comes in a lot of different ways and shapes, and coping looks really different for different folks. There are certainly some commonalities, but what we give and what we need in a given time and the way we cope in a given time can be really different from person to person, from time to time. And so, as well as how we can understand what it means to be overwhelmed. So one person, might think, well, overwhelmed is when someone breaks down crying. And I would actually say that breaking down crying can be really, really healthy, that releasing that and that having kind of a way to really just express and release that is really important. And so really looking at how do we understand what we mean by words like overwhelm, and then how can we support our own and our clients and one another's coping during this time. So I'm going to quote the current California Surgeon General, Dr. Nadine Burke-Harris, and she says that this tragic situation has greatly increased the amount of stress people are feeling right now. So, quote, "This certainly is a risk factor for what we call toxic stress, the overactivity of the stress response that leads to increased risk of health problems like asthma, diabetes, heart disease, and so on." And so some of the things that she goes on to talk about is the importance of being able to engage in activities that help us to metabolize stress. And we'll talk a little more later on about what are some things we can do for ourselves, our clients, and our teammates. So there are some things that we do know about some risk factors that increase the likelihood of developing a trauma-related disorder such as PTSD in response to experiencing or witnessing life-threatening circumstances. So some of those are chronic and prolonged threats to safety, check. Complexity of threats to safety. So for example, experiencing threats to safety related to COVID, as well as being quarantined with an abusive partner. So kind of the more different threats to our safety there are, the more complex those threats are, the higher the risk is for experiencing more of a traumatic stress. And then how direct the threat is to our safety or that of a loved one. So for example, if we're personally experiencing threats to our safety, that's a higher risk versus if we're hearing of someone we know being impacted, that's a slightly lower risk. So keeping in mind that particularly when we're thinking about children, that when children, parents, the safety is threatened, that is a very high level of risk for traumatic stress, just as if they were being impacted themselves. So thinking about what are some of these increasing kind of risk factors for growing stress, so people who may experience higher levels of risk related to stress and how the growing stress impacts our risk level. So according to the CDC, and this is all in quotes, stress during an infectious disease outbreak can include fear and worry about your health and the health of your loved ones, changes in sleep or eating patterns, difficulty sleeping or concentrating, worsening of chronic health problems, worsening of mental health conditions, and increased use of alcohol, tobacco, or other drugs. And, still quoting the CDC, people who may respond more strongly to stress of a crisis, so people who may be at a higher risk of stress, include fear and worry about your own health and the health of your loved ones, older people and people with chronic diseases who are at higher risk of severe illness from COVID-19, children and teens, people who are helping with the response of COVID-19, like doctors, other healthcare providers, and first responders, and people who have mental health conditions, including problems with substance use. Absolutely. And that, you know, the folks that we serve in our services many times already have all of these overlapping stressors and are trying to navigate all of these overlapping systems. And so how this all is then coming to bear when adding the additional stress and hardship of the current pandemic. So at the same time of all of these stressors increasing, access to safe and supportive resources is becoming harder. And so we see barriers to safe spaces such as work and school. So work and school, we can understand for many people are places of respite and safety when home is not a safe place. So some things to think about. Mandated reporting of child abuse and neglect by teachers is no longer a potential source of protection when children cannot attend school. And this also impacts access to food and other basic needs, as many families qualify for school-based nutrition support. This can also lead to loss of routine and safe child care, and people who are essential workers needing to rely on potentially less stable child care arrangements. So some other things to note here is that some data from the Child Help National Child Abuse Hotline, that they reported a 20% increase in calls and more than 4 times the number of texts compared to the same time last year. And that was as reported on April 6th by CBS's Aaron Donahue. And that we also know that calls to sexual abuse crisis hotlines are increasing. So just over half of the people who called RAIN's hotline in March who identified their age were under the age of 18. And of those, 67% identified their perpetrator as a family member. And then from that 67%, 79% said that they were living with that perpetrator. And that was reported by the Huffington Post. Florida has also seen an increase in calls to their child abuse hotlines, as well as local 211 services. And so for many people where, time literally going, leaving the home and being at work or being at school was a time that they could connect with safe social supports, with safe resources, safety resources, as well as just literally being in a safer space. And for people who, the person who is abusive in their household would be potentially leaving the home for work or school and is now home all of the time because of either shelter in place or experiencing layoff or furlough and just all of the increased risks that come with that. And barrier to safe spaces, thinking about office-based support. So think about the times that someone would just stop by your office just because it's a safe space, a place to connect in a supportive and safe community, or walk in seeking services, or just drop in to ask about a resource or just connect with someone. And I can think about the times I'd be sitting in my office when I was the director of an intensive outpatient. And the staff office had a window that was facing the sidewalk, and all the time I'd see someone walking to our front door, but they knew we had our window there, and they would kind of peek in our window and wave at us and be like, I'm dropping in, and we'd know that, the doorbell to our office would be ringing pretty soon. And people would just drop in just because, sometimes it was someone had lost a phone or had a phone stolen, or someone was in the neighborhood, right? And a lot of times it was just someone was feeling a craving or someone was not feeling safe at home and just would come in and ask, I'm not feeling safe right now. Can I just sit in your waiting area for a little bit? And I remember we would have doctor days one day a week. So the doctor would be in one day a week to check in with folks around their medication-assisted treatment as well as their mental health medications. I remember asking a gentleman one day, it was after group, and the group had ended, and I saw that he was, continuing to hang out. And I said, oh, do you have a doctor appointment today? And he said, no, I don't, but is it okay if I just stay? I feel a lot safer here than in my neighborhood right now. And so just thinking about how our office space can be such a protective resource for folks. And that for many people, our office spaces could have been one of the few safe spaces that someone had access to, in addition to our office space being a source of community and peer support. And then thinking about peer-based support, that even with tele-based group services for those who are able to access tele-based kind of group counseling, that there's still a whole piece that folks are missing out on. Just thinking about kind of like the before and after groups, all of the informal conversations that happen, all the ways that people access support from one another and learn about different resources or learn that someone's hiring, right? And that so many positive connections are made just in those few minutes before and after group and on group breaks, as well as thinking about how peer support is having what it looks like in the pandemic when it comes to mutual aid and fellowship and mutual aid traditions, just informal drop-ins. So, I've spoken with many folks that would have just kind of like drop-in hours where people could come in and, get some referrals and just have a safe place to be, and then the alumni fellowship. So thinking about our aftercare services, our aftercare groups, the different recovery events that we might hold to celebrate recovery, as well as kind of family and friends events that we might hold, both to provide information and services for family and significant social support. And then our faith communities as well, for people who do engage in faith communities or are part of faith communities, that many times people refer to their faith community as their church home, as their faith home. And what that means in a pandemic where people may not have access to that kind of in-person peer support, or community in the way that they did previously. And so also looking at all the ways that COVID-19 magnifies inequity. So earlier I mentioned, and I want to say we are at the hour mark, but I just have like 2 more slides and then we'll take our break. So I said earlier, right, that we have all of these kind of ongoing stressors that are just part of daily life stress. And then the pandemic happens and it just kind of magnifies everything. And all the things that we do normally to just survive and work and live become so much harder and take so much more effort during this time. Well, the other side of that is that all of the inequities and all the marginalization that exists is also magnified in this pandemic. And so all the forms of marginalization are leading to increased risk. So economic disenfranchisement, pre-existing conditions and inadequate healthcare access, homelessness, housing instability, and overcrowded housing, racial disparities, immigration status, and the digital divide. And so I want to share some data with you that is, and there's more data every day. I see more and more data coming out that every day around just how different inequities are getting magnified in this pandemic. So, you probably heard that. Sounds like my son is having a hard time right now. Hopefully it's not too loud on your end. So a report from New York City, which has been the epicenter of this pandemic in our country and really the world right now, a report from New York City showed that the neighborhoods that had the highest hourly service workers, the highest rent burdens, meaning that people are paying the highest proportion of their rent of their income to rent, and also coincided with the highest communities of color, as well as the highest rates of COVID infection. So that all of these burdens, including the disease and fatality burden, are being borne by the communities of color, who are also the communities who have the least access to income and the greatest risk of housing instability within New York City. In Chicago, where I'm based, it's been found that while African Americans make up 30% of the population, they account for 70% of our deaths due to COVID. So I'm just taking a moment because that reality takes my breath away, not in a good way. That reality should shock all of us. And that this is not unique to urban areas, and this is not unique to just New York and Chicago. That since I pulled this data, I've also seen reports coming out of other states and other much more suburban and rural areas that are also seeing that disease burden is being disproportionately impacting people who have lower incomes and communities of color, as well as people who have differing immigration status, who may not qualify or be eligible for all the different resources that are coming online. And that with, I'll continue to say more. And then I see here in the comments, what about Latinos? That's, so the data I mentioned from New York City and communities of color, those are largely Latinx communities, but also African-American communities, so both. And then there was a question about, did I say 70% of deaths? Yes, that in Chicago, African Americans make up 30% of the population, but account for 70% of our deaths due to COVID-19. And so just looking at all the ways that these intersecting forms of structural violence then increase the risk that people experience due to COVID-19, including the digital divide. So just looking at access to broadband internet, a report found that only 2% of urban populations lacked access, while 25% of rural populations lacked access. At the same time, access to broadband internet within a community does not mean that people can afford it or that people have the technology needed to access it. And so the digital divide also compounds inequity for children who cannot access remote learning opportunities without access to internet and technology. Those are some things to keep in mind. So one more mind-body practice before we take our break. So this is from Capacitar, and they provide their manuals online for free. They're an amazing resource, and they release all kinds of resources around disaster response and how to deal with the trauma that comes with disaster. So this one comes from Healing Trauma and Empowering Wellness. And so these are finger holds. And so you just take one hand and you wrap it around one of your fingers and you press firmly. Don't squeeze to the point of pain, just pressing firmly. And the different fingers are associated with different kind of forms of stress, anxiety, to help us metabolize those. So the thumb for grief, tears, and emotional pain. The index finger for fear, panic, and terror. The middle finger for anger, rage, and resentment. That one's kind of the easiest to remember, right? The ring finger for worry and anxiety. And then the pinky finger for lack of self-esteem. Or sometimes I think of this as self-assuredness. And you'll see down at the bottom of the screen where it says Capacitar, and then it'll also be on the references page. There'll be a link to their online resources as well. So with that, let's go ahead and take our break. So this says 10 minutes, but it's actually, I was informed it's a 5-minute break. So if we could be back at 12 minutes past the hour. Thanks so much, everyone. All right. Thanks so much, everyone. 5 minutes goes by quickly. So, thanks so much for coming back, everyone. We'll go ahead and get started back up. So now moving into ideas for what can help. And I'm going to ask for help right now for getting the slides back to where we were. Corinne, are you able to help me with that?
Yeah, I did transfer it back to you. You want to try it again? Do you see them now? Are you seeing it now, Gabriela?
Yeah, I'm seeing it now. Thanks so much.
You're welcome.
So, okay, so first, reflecting on resilience, that, resilience is our capacity to make adaptations that result in positive outcomes in spite of serious threats or adverse circumstances. So reflecting on that we all have access to different forms of resilience and ways that we can help support resilience in times of serious threats or adverse circumstances. So ideas for what can help. And these are just a handful of ideas, and I welcome folks to put more in the chat box that I'll try to keep an eye on and share with the group. So support strategies for clients, for teammates, and for ourselves. And first, starting with ourselves. So thinking of this as, we need to start with ourselves, and that we need to fill our cup before we can pour into others. Also, all of these strategies parallel the ways that we can support other people right now. So name it and claim it is the idea that when our feelings are just kind of like swirling inside of us, they can feel so much more nebulous and overwhelming, and that when we can literally name what we are feeling, acknowledge our feelings, and lean into that discomfort so that we can kind of move through it, that can be really helpful in metabolizing all those different ways that stress shows up. In substance use treatment, sometimes we talk about this as clean pain and dirty pain. That clean pain is the pain that's part of just living, and dirty pain is the pain that happens when we avoid the pain that is a part of life. So all the things that we do to kind of escape pain versus being able to deal with pain. Now that said, that doesn't mean that we're always in the place of being able to just deal with pain, right? It's not, we don't want to take an all or nothing approach per se. Sometimes we just need to get through the moment without making matters worse as best as we can. But this name it and claim it piece can be really helpful in recognizing our feelings and moving through our feelings. Physical wellness, so supporting our physical well-being, things like sleeping, eating, getting active, staying hydrated, be mindful of our caffeine intake. And I know that everything in my body is like, drink more coffee, eat more chocolate, sit in one place. I wish I could sleep for a day, right? And so a lot of times we have to kind of select our actions based on what we know will be more helpful for us, and remembering how we feel when we are kind of eating in more balanced ways, when we are maintaining some level of activity, when we're drinking more water and things like that. Connecting with loved ones and talking about feelings, as well as enjoying conversations that are not about the pandemic. Sometimes we can even have some feelings of guilt if we're talking about things that aren't the pandemic, but also knowing that this is really important, a really important part of being able to take care of ourselves and take care of our loved ones. And then, let's see, Teresa wrote here in the comment box, do a kind deed for someone. Absolutely, that when we're nurturing others, that we nurture ourselves as well. And then Anne also wrote, sharing with one another when we see or hear something that has impacted us positively. Absolutely. Thank you for sharing that, Anne. So also being able to focus on, it makes me think of Mr. Rogers, right? The famous Mr. Rogers quote is, I don't have it in front of me, so I'm not going to remember it word for word, but the kind of sentiment of focusing on the helpers, looking for the helpers. And then Karen writes, do a gratitude list every day. Practicing gratitude also has a really great impact on our well-being. And Rachel also wrote the same thing, gratitude list. And then Dr. Teresa Jefferson wrote laughter. Absolutely. I think that's why we see a lot of people coping through memes right now, right? Different jokes and just laughter in general. And connecting with sources of solace. So it may be helpful to think about what has helped you get through tough times before and of making a list of your go-tos. So this can look like making a playlist of songs that are comforting, connecting with people who are especially grounding, connecting with different cultural traditions, which can be especially, take some, I would say, particular intention, especially when so many of our cultural traditions are based in gathering and building community and being physically present and together. So what that looks like. And for many people, this will also include seeking solace in faith and spirituality. And I see here that many people have put in the comments prayer for ourselves, for loved ones, for those we know who are struggling, including our clients. And then Barbara offers a great YouTube video on resilience is the 3 Secrets of Resilient People by Lucy Hone, which is part of a TEDx talk. And then Jessica shares a tip from another PD that I took was connecting gratitude to something you do with an action. So e.g. turning off the lights. So something that you do in just part of your daily routine, that's then practicing gratitude, building that into the daily routine so that you remember to do it throughout the day. I love that. What a great idea. And then, of course, deciding how much media is helpful to read or watch. I know for many, our lives are so already kind of intermixed with media and thinking about not just media like the news, but social media and all the different ways that media comes up in our life, that it almost becomes this kind of constant in the background, and that we almost feel like it's almost like the rubberneck effect, where it's like you can't look away. So being really intentional around how much media is actually helpful in staying informed. And then when you do decide how much is helpful in staying informed, then going to accurate public health sources of information, understanding that there's a lot of misinformation going around, and that it can go around with really good intentions. I remember receiving from a neighbor a text around like a breathing exercise to do to prevent COVID. And I looked it up and it wasn't, actually based on anything accurate. And being able to let her know, like, hey, I really appreciate the sentiment. And so, this isn't actually something that there's any evidence around. And so we still need to do all the other things to keep ourselves safe. And then connecting through telehealth. So some things that can help here. So there is expanding coverage for telehealth services. There's expanding coverage through Medicare, Medicaid, and many private insurers. This is something that is changing every day, so staying on top of it can be somewhat difficult for sure. And that additional expansion is still needed for full reimbursement of phone-based services because not everyone can access video platforms. So some insurers are starting to offer full reimbursement for phone-based services, but some are not. And so we may need some additional advocacy so that there's full reimbursement for that, so that people don't get caught up in the digital divide. And that providers are temporarily allowed to use non-HIPAA compliant video conferencing platforms, but even so, it's still recommended to use confidential platforms wherever possible, and it's still really important to have informed consent to telehealth that provides information on the potential risks when it comes to confidentiality. And that confidentiality, we really need to approach it as a safety need. That confidentiality is a safety need for people who may be experiencing abuse, and that we many times don't know who is at risk of experiencing abuse, because many times people experience increased risk to their safety by even saying that they're experiencing abuse. So really keeping that in mind. We want to take kind of a universal precautions approach to the safety needs that have to do with family-based violence. And so in that vein, thinking about, and something I'll mention is that our center, the National Center on Domestic Violence, Trauma, and Mental Health, is actually publishing a whole policy guideline around the use of telehealth and expanding confidentiality and privacy and balancing that with safety needs. And so someone wrote in the comment, Erica wrote, maybe come up with a code word that a client can use as a clue of distress. Absolutely, Erica, and a perfect segue for my next slide. So how can we think about telehealth and safety for survivors of domestic violence? So of course, striving to use secure methods of communication and supporting informed decision-making and consent so that we're not making decisions for survivors, we're providing the information that we know and helping them to make their own decisions around balancing being able to access services with their safety as it relates to confidentiality and how that intersects with their safety as it relates to domestic violence. Of course, safety planning, having flexibility with appointment times and rescheduling, which I know can be difficult for a lot of places that are billing insurance and can face loss of revenue when appointments need to be rescheduled or canceled, but also understanding the need for safety and access during this time, and that we all need to be more flexible. We can ask more yes or no questions to establish safety and confidentiality at the start of the session. So asking things like, are you alone right now? Is it safe to talk right now? Right? So that they can just answer with a yes or no before going into more kind of open-ended discussion. And then, as Erica mentioned, establishing a safety code word or phrase so a survivor can discreetly communicate that they can't talk right now or if they need help. And I've actually seen some communities are starting to do this as well, where I just saw something yesterday where it talked about that communities are kind of putting in place, for example, using like a different kind of code word to ask for a medication refill, and then and that if the person says, I'm calling for a medication refill in a particular way, then the provider can respond with, do you need me to call police right now? And then the survivor can, if they do need police to be called, they can respond with, yes, please send the medication to my home. This is my address. Now, of course, we can't always have just one blanket code word in this like safety code word or phrase in this situation, because first of all, then that also means that people who are using power and control against their partners will also know that safety phrase. And also, there may be certain safety phrases that are just so irrelevant for somebody that it would seem like really suspicious if they were to use it. And so in this way, it does become important to individualize this for people and then to have a place in their record where this is kept and can be easily accessed so that staff are aware. And then using creativity around what is safe and confidential spaces for a survivor to have their session. And so understanding that some survivors may not have any access to safe and confidential spaces and may only be able to access services through texting. And so what does that look like? And how can we use encrypted, kind of end-to-end encrypted texting? I know I've talked with one organization in New Mexico that they're using WhatsApp for encrypted end-to-end texting. And also looking at, talking with folks who are, going to their car to take phone calls and going to, just finding, going to a bathroom and kind of running a shower or running the faucet. Now, I'm not going to say anything about water conservation right now. I'm going to remain neutral on that because we are in a pandemic and people need to do what they need to do in order to survive. And then Erica also suggested a good one would be Leo. A client can say it as someone's name. I need to speak with Leo, and Leo can stand for law enforcement officer. That's a great suggestion. Thank you. And then, of course, within all of this, really supporting uninterrupted access to medications. So, so there is expanding access to medication-assisted treatment through telehealth, both video and telephone prescribing. In methadone, states can apply for blanket exceptions to allow for 28-day take-home for clients who are stable and a 14-day take-home for clients who do not meet the, quote, stable criteria. And that this can be prescribed without an initial in-person examination. And some things to keep in mind is that a client may need a payment plan to be able to afford to pay for their take-home in advance if they are accessing methadone through self-pay. SAMHSA has published several guidance documents specific to opioid treatment programs as well as ambulatory withdrawal management for alcohol and benzodiazepines. Something else is that buprenorphine can now be prescribed through telephone-based evaluation for new and existing clients. And then additionally, the importance of supporting access to psychotropic medications and support for co-occurring disorders is even more important. It's always important, but even more important during this time marked by stress and uncertainty. And then someone is asking, what about injections? What could be done if a client can't make it in? So one of my former employers has actually partnered with a federally qualified health center to be able to have a mobile van for injections. So people who aren't able to make it in for an office, they now have a nurse going around in a mobile van who is able to give injections to people who are not able to come in. and that, of course, this is done with all of the personal protection, protective equipment possible, and with all of the different sanitization processes possible. Great question. And then thinking about connecting with mutual aid. Some different things that can help here. There are a lot of people who are now hosting online meetings and chats. There's also phone-based, both voice and text-based support. There's also a range of recovery apps. So different smartphone apps that people can download where they can chat with other people in recovery, where they can connect with different kind of peer-based support. And then there's also social media is being used in different ways to connect with peers. And then when, to kind of supplement this virtual connection, something that can help is listening to podcasts, watching videos, as well as connecting with different readings from the different traditions. Actually here in one of the Chicago-based newspapers, one of the journalists wrote out kind of like a scripted 12-step meeting and said, if you need to get to a 12-step meeting and you can't make it and you can't connect with anyone virtually, just imagine this and read it out loud. So almost like a guided meditation for attending a 12-step meeting. I thought that it was very, very creative, and I loved seeing something like that in kind of a public newspaper. But what does this mean in light of the digital divide? So many systems are currently seeking to address the lack of access of digital resources. The CARES Act includes funding for museums and libraries to address the digital divide. In addition, some internet utility providers are offering up to 2 months free connection and subsidized rates. So for potential resources, here are some things you can check out. City and county governments, school systems, library services, and then local internet providers. And different communities are coming up with some pretty creative responses to this problem. For example, I read about South Bend, Indiana, has actually taken buses and has parked them throughout South Bend, and the buses are providing Wi-Fi. They're Wi-Fi hubs for students to be able to have access, free access to Wi-Fi in order to access online virtual learning. So there are, different communities are coming up with creative responses to the digital divide, and it's something that we need to find out, kind of plug into what's happening in our community, as well as advocate for more expansion. And I see here from Dr. Teresa Jefferson that Manatee County School District is doing the same thing. Great. And then, of course, helping address basic needs. So resource advocacy is crucial for many. It's always crucial, but it's crucial for many, many more people right now. And so seek out existing and expanding resources, and that phone-based case management follows the same best practices as in-person services. And I know folks are curious about different resources. In the final portion of this webinar, we'll have a whole resource listing that we'll go through. But again, keeping in mind that not everyone will have access to emergency assistance programs, and so many organizations and nonprofits, as well as counties and cities, are setting up assistance programs for people who don't have access to mainstream resources. And then Natalie also put in the comment box, thank you, this is so important, that the digital divide can be age-related as well. Many that are older may not know or understand how to use digital items that are available to them. So training for elders in the use of digital tools is important as well. Absolutely, that digital literacy is not the same for everyone for a whole host of different reasons. And so the need to really have accessible understandable, clear information, and intuitive technology that has ease of access and real live support in using technology. Absolutely. Now, when it comes to supporting mental health, there's so much that we do every day already for supporting mental health. So I just selected a few things to highlight here. One comes from dialectical behavioral therapy, and it is ABC, please. So ABC stands for accumulate positive emotions. So here, building in pleasant activities as part of our daily routines and rituals. So a great example is that tying that gratitude practice to something that's really routine, like turning lights on and off. Building mastery. So here we're talking about doing one thing at a time that helps nurture our sense of confidence and control by building on our strengths, skills, and talents. So you'll notice that there's been a huge surge in doing jigsaw puzzles during the pandemic. This feeds right into that building of mastery. Jigsaw puzzles really focus our attention, and so we're kind of doing that one thing at a time, and we're building it piece by piece, and then once it's done, we kind of stand back and go, wow, look what I've built. Look at this, beautiful puzzle, right? And so things like, and it also helps us accumulate those positive emotions. And then coping ahead of time. What this means is rehearsing a plan ahead of time so that you're prepared to cope skillfully with situations. Now, many of us are probably finding ourselves already doing a version of this with, but there's a fine line between anticipatory anxiety and coping ahead of time. And so anticipatory anxiety is that, I'm already kind of anticipating the stressors that are coming, and I'm having anxiety based on what's to come. Whereas coping ahead of time is I'm aware of potential things that are to come that may be challenging, and I'm going to think about what could help in those different situations. And then the please part. So this is really about reducing our vulnerability to stress. So treating physical illness, taking care of our body, seeking out medical care when needed, and this includes, of course, seeking help around and support around mental health and substance use. Balanced eating. So, being attuned and paying attention to what it is that we're intaking, and that we don't want to eat too little or eat too much. Avoiding mood-altering drugs, including alcohol, which for many of us may be easier said than done, obviously. If it were that simple for many of us, then many of us wouldn't work in treatment, right? And then balance, and what I'm finding here as I talk to treatment providers and I talk to clients is that people who are in later stages of change and more maintenance stages of change find that knowing that their health risks are increased by using substances is helping them maintain their sobriety, that it's like another reason to stay quit. But for people in earlier phases of change, who are in earlier phases of action or preparation or contemplation, that this is acting as a huge relapse trigger. And so really seeing much more returns to use and potentially chaotic use. And so something to keep in mind here is not beating ourselves up either if and when we experience a return to use or a setback in our recovery goals, and the importance of harm reduction practices and mitigating those harms. So when we blame and shame ourselves around struggling with avoiding mood-altering drugs, that just actually really kind of digs our heels into the substance use problem and turns that maybe lapse into a relapse. And then balanced sleep, sleeping the amount that feels good, that you feel like you need. And then exercise. building up to 20 minutes per day of exercise. And the important piece here is building up to. It's, any positive, any progress, progress, not perfection, knowing that physical activity can be challenging for a lot of us right now. So when someone is experiencing crisis and can't quite tell us what they need in the moment, some things that can help. One staff person leads in the interaction, focuses on making that connection, that we remain clear, calm, and focused, and that we consider what people want for themselves. What have they already shared with us is helpful in times of crisis, that we create the space and really take our time, that we act as if we have all the time in the world. A lot of times when we try to rush things get harder, that we stay collaborative and offer choices. We use simple, concise language. Many times we get nervous and we say too much. we say the same thing 3 different times. And so staying really, in brief, concise language and allowing for that space for the person to respond and just take in what's being said, and that we neither fuel nor challenge their beliefs. If someone is telling us that they feel really helpless right now, that we're not responding with, "You're not helpless, I'm here to help," right? That we're not just trying to silver line or challenge or invalidate, but that we're really finding ways to respond that are validating. We've also heard from crisis line responders that it can be helpful to ask people if they have a pen and paper available and encourage them to write or doodle or draw while talking on the phone. And that this seems to help people get grounded so that they find it easier to then start talking about what it is that they're experiencing and what might be helpful. And so here's a visual piece of what we can do, right? We start by that active listening, validation, and Erica offers validating their feelings, and then offering action that is possible in the moment. And this can be as simple as, would it be helpful to take a breath together, right? It doesn't have to be huge, groundbreaking action, right? That when someone's in crisis, sometimes it's those really, really small things that can help us get back to a place where we can then start focusing on solutions. So for the person you're supporting in this moment, what's possible? What do you know from them that might be helpful? And what's been supportive with other people that you might try? And how important it is to offer but not prescribe necessarily. And I often think about the power of co-regulation. So even being able to role model in that moment, I'm going to take a deep breath. I wonder if you'd like to take one with me. And then using kind of like that, audible breathing so people can hear us breathing. And it kind of helps to co-regulate together. So then switching gears a little bit and talking about supporting parents and caregivers. So first of all, helping to recognize and normalize common stress reactions. So knowing that excessive crying and irritation in younger children is absolutely normal, and that returning to behaviors that they've outgrown, like, accidents and bedwetting and things like that, that it's very, very normal to have kind of regressions during this time. That children may express worry and sadness in different ways through many times, for example, refusing food or refusing any food that we're trying to give them, right? That when everything feels so out of control, that controlling what goes into their body is a way to try to exert just any kind of agency in the situation. Irritability and, quote, acting out behaviors, as well as avoiding school or struggling with school, struggling with paying attention or concentration, as well as unexplained headaches or body pains. And then in, more preteen and adolescent children, potentially the use of substances. So really being aware of these as not something that children or adolescents are trying to do to stress us out, but are doing because it's really a sign for help, right? So supporting parents and caregivers to take the angle of what is my child showing me that they need right now, and how can I help them? And then, of course, the complex feelings of wanting time with family, especially for people where family is a really core value for them, but then also feeling overwhelmed by that. And I am recognizing the time, so I am going to pick up the pace a little bit. So what can we do to help? Offer realistic ideas and accessible resources to support developmentally appropriate conversations, and help parents really think about their children's exposure to media, including social media. Also helping parents think about how can they role model and share positive coping, and then supporting routine while also recognizing what is realistic. So think about how parents and caregivers may need extra help during this time in navigating systems, including educational systems, legal systems, food access, and potentially child welfare systems. And then supporting children and youth. So child welfare agencies and child advocacy organizations have quickly adapted to meet the changing terrain, as child safety is critical during the pandemic, especially as children have less access to safe spaces and adults who can help. That said, these systems, like all of our systems, are inundated and overwhelmed and experiencing, increasing caseloads, and may have staff out due to illness. So specifically, DCS in Florida provides COVID-19 guidance on their website. And so there's a lot of different resources that they offer in a lot of different areas specific to COVID-19, including child welfare. So Scott Berkowitz, the president of RAIN, which is Rape, Abuse, and Incest National Network, recommends if there's a child or parent you love, call those kids and spend a half an hour on the phone or, through video chatting. Give the kids another grown-up to talk to. If all of us can do that, we're going to give parents a break, and we may also find a kid out there who needs our help. So a lot of this is just showing up when and where we can. And in looking at our services, looking at what of our services that are specific for children and families that need to get beefed up right now. And then, of course, collaborating with child and family advocates to support safety for children. Collaborating with DV advocates, knowing that DV services are still operating, different courts and legal remedies and advocacy is still available, and that DV services have a lot of different children's services and resources as well, and that there are expanded resources for safe shelter in place. So no one should have to shelter with someone who is abusive. And so team-based support, if folks can go ahead and put in the chat, what do you find supportive from coworkers? So supporting teammates, really connection and communication, that personalized connection, recognizing unique strengths and contributions, and individualizing our contacts. Some teams find it helpful to start the day with a check-in. Just asking how folks are doing, and then building in time for peer support. And folks are saying, brainstorming on issues and solving problems, encouraging one another, weekly team meetings, end of the week positive quotes, sending different kinds of resources, solving problems, absolutely. And then also, if you can put in the chat, what do supervisors and leaders put in place to support staff at your organization? And so leading in times of crisis, there's a lot of information around leading in times of crisis that are specific to leading after, for example, the crisis of 9/11. Now, something that's a little bit different here is that this is an ongoing crisis. This is not just an acute trauma that happened and now we're dealing with the fallout. This is an ongoing uncertainty and crisis. And so in that way, we're all kind of learning as we go. But here are some really core aspects. So in addition to addressing needs for sanitary practices, personal protective equipment, and transitioning services to virtual methods wherever possible, as well as making sure that we have sick time benefits and health benefits and all of those things, there are some different things we can do to invest in client and staff well-being. So first off, prioritize. What is absolutely essential, right? This is a time for us to get kind of real lean around what is essential. And part of what's essential is clinical supervision. But that's not something that gets cut out. That's something that we actually need a lot more of. That we offer flexibility whenever is possible. Understanding that everyone is stressed right now and that adding to stress isn't going to produce better outcomes. So I was talking with someone who was saying like, she shared with me, how is my boss responding to the pandemic? Well, I just got an email that my productivity needs to go up. Okay, so adding to that pressure isn't actually going to produce better outcomes, right? It's just going to add to that sense of overwhelm. Focusing on staff engagement, demonstrating our confidence and trust in staff. I was talking to another person who said that their leaders were requiring people who are working from home to submit like a calendar of all of what they had done like every hour, every minute of that day. That is so incredibly stressful and is going to get in the way of being able to actually focus on the things you need to do, right? And then building in routines that support connection. So some things that people have offered in the chat. My supervisors have offered understanding, flexibility, and provided time for us to staff our cases during supervision as well as needed on a case-by-case basis. Weekly uplifting emails, daily check-ins and check-outs, being compassionate with coworkers in different situations that they're dealing with at home, allowing us to work from home, not putting pressure to be at the office. Absolutely. Thanks, everyone. We have 5 minutes left, so I'm going to go in hyperspeed now. So connecting with resources. So here's a list of financial resources. 211 is a great place to start. A lot of different counties have set up their own emergency assistance programs, and those can be found through calling 211. Here you also have Florida Department of Children and Families Access Program, Florida LIHEAP, the Employment Assistance, Food Access Programs, Child-Teen Food Access Programs, and then, of course, information on the Federal CARES Act. For healthcare access, and I knew that I saw a question come through earlier around how do we get people access who don't have insurance at this time. And so the Florida Association of Community Health Centers has information on finding healthcare resources for people who are uninsured or who are having a lapse in their insurance benefits. And then this guide from the National Alliance on Mental Illness has a whole lot of information on resources specific for COVID-19, and they have a specific part around how to access healthcare and medications if health insurance is interrupted, as well as information on mental health support and safety resources. For mental health, there's SAMHSA's Disaster Distress Helpline. So for people who are having just different feelings come up in response to the crisis we're going to, there's a lot of available here through SAMHSA's Disaster Distress Helpline. Then there's also the Safe Space by Vibrant Emotional Health. And this is actually a really fun website that has a lot of different interactive components that support coping as well as answer basic questions about different stressors that people are dealing with. There is this resource, the Emotional Wellbeing During the COVID-19 Outbreak. This is more of a tip sheet from the Suicide Prevention Lifeline that also has a resource list. And then Mental Health America also has a ton of resources on supporting mental health, including virusanxiety.com/takecare, which is specific to anxiety about COVID-19, which is a very real thing. And then guidance for substance use treatment. And something I'll mention is that SAMHSA's line is available in multiple languages as well as TTY. So substance use resources, we will have a future webinar specifically on relapse and overdose prevention. But here's some resources in the meantime. iSafe Florida Overdose Prevention, COVID-19 guidance for bridge programs and MAT services, which also includes how to stay safe during this time. And then SAMHSA has published several guidance documents to support safety and continuity of care, including guidance for OTPs, outpatient mental health and SED, and withdrawal management for alcohol and benzodiazepines. Something to keep in mind here, I saw a question about being able to use video telehealth for prescribing methadone, and SAMHSA's website does have more information on that, as well as from the DEA, who has expanded that. Resources for mutual aid. There's a lot of different traditions that are now making, really beefing up their virtual offerings. And one central place that you can go to check out these resources is from SAMHSA, Your Recovery is Important Virtual Recovery Resources. And this is a great catalog of all the different traditions as well as resources for mental health support. Some harm reduction resources from the Harm Reduction Coalition and Vital Strategies, as well as the Yale Program in Addiction Medicine Global Health Justice Partnership and Crackdown, adapted from 3D research, so how to stay safe and mitigate those harms for folks who do experience a return to use or continued use, as well as additional resources on preventing overdose. And then resources on just telehealth. How do I do this darn telehealth thing? What are best practices? And then some specialized resources around substance use and mental health. So use of telemedicine while providing medication-assisted treatment. This is from the, specifically the DEA. And then telehealth tips for responding to any kind of suicidality. Tech safety and domestic violence. There's a digital services toolkit from the National Network to End Domestic Violence. And then some additional DV and COVID-19 resources. Specifically at the top, you'll see the landing page for our center around COVID-19 resources, as well as some other centers. Resources for domestic violence, some of the hotlines, as well as the Florida Coalition. Hotlines for child abuse and sexual violence. And then family support. So guide for helping families cope with a disaster and the COVID-19 disease, as well as caring for children during a disaster. Some more on family support from the American Academy of Pediatrics, from the CDC, and from Mental Health America. And one of these, actually the one from the CDC, is an interactive coloring book that can help parents talk with children about crisis and supporting healthy coping. And then supporting teammates. So here are some different tip sheets and resources. And then resources for self-care. The virtual room of refuge is so cool, and it's really interactive. It has a lot of different coping strategies and supports. And then there's also this tip sheet from the Northeastern Caribbean Mental Health Technology Transfer Center. So some ideas of steps you can take next. And we are officially out of time. So I would ask anyone to please feel free to reach out to me. I'm going to put my information up on the screen here. Please reach out to me and feel free to reach out for more resources, more ideas, additional needs. And then on May 5th, we'll have one specific for relapse prevention and overdose prevention. And I hope to connect with many of you again then. Stay safe, stay healthy. Let's all take care of one another. We're all in this together. Thanks so much, everyone.
Gabriela, thank you so much for your time out of your busy day. I know things are pretty hectic, and you shared a lot of great information. We've had a lot of great responses. You did a really good job at addressing everyone's comments, concerns, and questions. Just wanted to reiterate to everyone that the slides and recording will be up on our website within 30 days. I know a lot of you have asked. And we do thank you for also joining today. If you could please note a couple of items of business before we conclude today. When I conclude today's webinar, your browser will take you to an evaluation on FADA's new website. If you want to receive CE credits or a statement of credit for this event, please complete the evaluation. You will be prompted to register or sign in to complete the evaluation. You can register as a visitor at no cost. For CEs to be reported to CE broker for Florida licensed healthcare practitioners, you must provide an accurate Florida Department of Health license prefix and number the first time you register. After you register or sign in, you will be directed onward to the evaluation. You may consider using the same email address when you register for webinars through our WebEx link and when you set up your profile in FADA's system. This helps connect your attendance and your profile. You will get a second opportunity to complete the evaluation through a follow-up email later today in about 30 minutes. The sender will be Messenger at WebEx. The evaluation will close at midnight on Friday, April the 17th. We do not email statements of credit. Instead, after we verify attendance and completion of the evaluation, a statement of credit will be generated as a journal entry within your profile. And we thank you for participating in today's webinar, and we'd also like to recognize and thank especially the Florida Department of Children and Families Office of Substance Abuse and Mental Health for funding today's education. Have a great rest of your day, and please hold for the evaluation and stay safe. Thank you.